Hi, this is Dr. Dumestri. Thank you for such a great question. Definitely a complicated one to answer. So this person is asking me, they've had their mastectomy done for cancer treatment, they had an implant-based reconstruction, and they've had radiation. They're now experiencing issues with their implants, and I'm not 100% clear if they're looking to just have their implant out or implant exchanged. So radiation, what does it do? It's extremely useful in the sense that it helps to kill and take care of any little cancer cells that may still be floating around after the mastectomy and prevents local recurrence. Now, radiation is also damaging to healthy tissue in that process and results in really inelastic skin that has no stretch to it. It has chronic poor blood flow, so poor delivery of nutrients to the area, and has a decreased capacity for healing. So we do implant-based reconstructions in the setting of radiation because there is definitely a subset of women who go on to have a reconstruction that they feel good about, even if they have some of that tightening with that. And then there's also a large subset of women who have significant issues related to their implant and need further surgery. So I would say that yes, I do agree with your plastic surgeon that I do whatever I can to avoid operating on the radiated breast. Now, if you're just looking for plain implant removal, a flat closure, even in the presence of radiated tissue, I would absolutely do that and offer that. Now, if you're looking for an implant exchange, that really is a case-by-case basis, depending on how bad the radiation is, how thin your skin is, and there's certainly always a high risk of complications when we are doing implant adjustments in the previously radiated setting. One possible option, if you were looking to still have reconstruction, not looking to go flat, that we'll often do in the presence of complicated implants or history of radiation, would be to take some of your own tissue from elsewhere to reconstruct that breast. So the deep flap, if you're a candidate for that, taking the tummy tissue to move up there. Pap flap, we can use inner thigh tissue, you can use your upper buttock tissue or lower back. You could also bring in a latissimus tissue if you can't quite handle a long surgery like the free flaps and do an implant with that. So there are options, but honestly, often the straight up implant exchange in the presence of previous radiation is not going to be an option that your plastic surgeon will offer to you.